Nice to meet you.
Nice to meet you.
What's your name?
Leah.
Hi. Well, why don't you tell me a little bit about yourself?
Well, I'm a senior at Northeast Hamilton. I've grown up in the area, and I grew up in an agricultural background with both sets of grandparents farming, and my dad periodically helping to combine or drive loads into the elevator. And our favorite thing when we got to Grandpa's after school was, "Grandma, can we go ride in the tractor with Grandpa?" And that was just always our favorite thing to do. And then as I grew up, I got more involved in 4-H and school and various youth activities.
Okay. So what kind of activities are you in right now?
Right now, I'm in volleyball, basketball, golf, softball, and then 4-H and youth.
Okay. Do you do any volunteer work?
Yes, our 4-H, we have county council, and that's not as much volunteer work, but we help the younger kids with projects, and like our 4-H group does the Santa Sacks for the Williams, when Santa comes to Williams.
Okay.
And then through youth, I help serve meals, and we have a booth at the Hamilton County Fair where we serve food, and every summer we go on mission trips to different parts of the country, and while we're there we can do Kids Club, which is a VBS type thing, or we can do work projects, which might be painting a house, building a house, helping people learn English,
Okay.
wide range of things.
So what made you decide to go into occupational therapy?
I chose occupational therapy because I've always had a passion for working with people. I've always looked for where I could help ever since I was a little kid.
Okay.
And I originally wanted to be a teacher, and then I kind of progressed into physical therapy, and then I went to a college visit and they told me about occupational therapy, which was a little more psychological, and I really enjoyed my psychology class
Okay.
that I've had, so I thought I can kind of get the best of both worlds with the psychology I enjoyed and helping people.
Okay. So tell me, what is your definition of occupational therapy?
My definition of occupational therapy is helping people once they've had some sort of accident, or if they didn't develop what we would consider normally, and they have to relearn or learn a abnormal way of doing something so that they can function with how their body works.
Yep. So I like to tell people that we're a functional therapy. The physical therapist will come in and they'll get them moving and get them stronger, but our job is to make sure that they can go home independently. So function and independently are they coincide with occupational therapy. So what do you think you'll like best about occupational therapy?
I think what I like best is getting to see and work with a wide variety of people, and it's not a routine day in, day out, same boring paperwork or anything. It's something different each day.
It's a lot of paperwork, but yes, it's different every day. You see different people every day. What are some good qualities that you feel are important to have as a therapist?
Some good qualities is you've got to be friendly. You can't be a grouch and work in therapy. You have to like people, and you have to be a good communicator.
Yeah.
You have to be able to figure out how somebody learns best, or what analogies you can use to help them figure it out. And you have to be able to work around moods. You have to be able to get people to work even when they don't want to. And
Yep, exactly. So what kind of strengths and qualities would you bring to OT?
strengths and qualities that I would bring to OT is my caring, understanding nature. I try my best not to judge people based on what I see or what I hear. I try to give them a chance to define themselves, and I care about people on a personal level, they're not just another job, they're a person themselves.
Yep.
And I understand and I empathize with what they're going through, especially if it's a situation that I've been through myself.
Okay. So what kind of a setting do you want to work in?
The setting I would love to work in would be a VA, and helping veterans that have put their lives on the line for us to regain their freedom that
Okay.
they fought for.
Very good. Probably what would be your your least favorite setting?
That's hard.
It is hard.
I like people, so my least favorite setting would probably be one where people don't get the proper care they need, and one where it's just do the basics, get them out. Because I want to do a quality job to make sure they learn everything they can to be as independent as possible.
Okay. Do you plan to stay in Iowa?
I would like to stay in Iowa, but I would be willing to move if there was a job opening in a different state.
Okay. OT in Iowa is, you'll definitely have a job. You know, I get postcards twice a week, I get phone calls twice a week, so. What do you think, what is your opinion on healthcare?
My opinion on healthcare is that it needs to be the person's choice and who's receiving the care. And it needs to be their choice of if they want to go to a specific hospital or if they want a specific plan for healthcare, and they should have their independent choice and they shouldn't be forced to do or choose something just because they have to have it.
Right. Do you think our healthcare system do you think it runs smoothly?
I don't believe that it runs smoothly. There are gaps in the system, and
Definitely.
there are people that may need assistance with healthcare and can't get it because they may be confined to a wheelchair in their home, or they may not have the access to the internet to go online and get a plan or a vehicle fit for their possible handicaps so that they can go out and go to an insurance company and get the help they need.
Yeah, there's lots of things broken in our healthcare system today. How do you handle stress?
I'm pretty good with stress. Being so involved, I've had to figure out how to get my homework done between practice and games and 4-H meetings and youth and just the mission trips themselves. You get in a situation where you get a lack of sleep and you're doing something, and not everybody always gets along, so you have to deal with that stress of not everybody getting along and keep your composure and not snapping.
Okay. So how would you handle a difficult patient?
I would handle a difficult patient by talking to them, seeing if there's a bigger issue than just they don't like the fact that they're confined to a wheelchair, or even if it's just they're still getting used to their wheelchair or prosthetic or something, whatever their necessity is, and so they just don't want to, they're kind of in a state of denial, and see if that's it, or if there's another issue, and see if I can help them out of that issue so that they would be willing to work with me on their exercises so they can regain their independence.
Yeah, and sometimes you just have to let them be. And sometimes a different OT could come in and get better results. It just depends. What kind of salary are you looking for?
I'm looking for a salary that will support me in my basic shelter, clothes, food to start out with, and maybe as I get more experience, something a little more. It's just what kind of a take what you can get to begin with. And
what kind of number are you looking at, do you know?
I've done some research and it says about $55,000 yearly on the research I've done for an OTA.
Okay. It definitely depends on where you're at and what you want to do. In Iowa, long-term care probably pays the most. Probably the least paid is outpatient. So it's definitely just whatever you want to do and where you want to go. What other benefits do you need?
I would look for health insurance and maybe some dental insurance, like a basic insurance plan where if it at least covers the basics and I can get more to supplement it if I need to, and paid time for sick days and at least somewhat of a retirement plan.
Yes, definitely. Do you have any questions for me?
What is your favorite age group to work with?
At the hospital I get to see everybody. I used to think I loved pediatrics. I'm not a pediatric therapist for sure. So, you know, I don't know, I see outpatients and I do a lot of hand therapy. So, and they're all ages. I don't know. I don't really like long-term care all day long. It just depends. I don't want to do the same thing all day long, so.
It's kind of whatever variety you can get.
Yep, exactly. And when you work in Iowa, you're gonna need to know a lot about lots of different things, because your day is gonna be so different than just, if you just did pediatrics or you just did neuro or whatever.
That's what keeps it fun.
Most days. Most days it is fun. Yep. Anything else?
Not that I can think of at the moment.
Okay. All right, well, very good. That's all I have. It was nice to meet you.
Nice to meet you.